Well, I thought we ended up with a fair agreement. In these type of things, you never get everything you wanted, but at the end of the day, we worked really hard with not only the CSAC advocates, but also with our stakeholders and with our coalition partners to really explain to the governor and the legislature how important it was that counties retain funding necessary for both public health and for their remaining responsibilities to cover the residually uninsured. And that was a huge deal, and at the end of the day, I thought we got a good deal for counties. The governor and the legislature and Department of Finance, they all have their own goals in a negotiation like this. And it was clear the governor was concerned that he would be paying counties for their healthcare responsibilities, and at the same time, those responsibilities would be reduced by the Affordable Care Act, and he didn't want to, quote, pay twice. Well, I think the key was to demonstrate to him, to the Department of Finance, and to the legislature that we had really substantial costs that were going to be remaining even after the implementation of the Affordable Care Act. My experience with this governor and with this legislature is they really respond well if you can show facts, and that's what we did. We had a number of our members, a number of counties came together and said, here is the real world impact on our county budgets and our ability to meet our obligations in public health and to the poor if you take all of these funds, and that was compelling. When we met for our legislative meeting, the supervisors of California made it clear to me that in negotiating this deal, their number one priority was no more realignment. Counties have been doing a good job dealing with public safety realignment, but I think a lot of folks felt like that was all we could do right now, and so to take on programmatic realignment or realignment of social services, that was a bridge too far. We explained that to the governor in no uncertain terms. Our officers went to see him twice on this issue. And finally, with help from legislative leadership, the governor agreed, and we have no more realignment, and I think that was a big victory. We couldn't have done it by ourselves. Our officers and our members are very strong advocates, and they pull a lot of weight in the Capitol. That said, we're even stronger when we work in coalitions. And so everybody from SEIU to the Association of Public Hospitals to the welfare directors, everybody kind of pulled in together to say we've got to have enough funding for counties to be able to handle their responsibilities. We can't have more realignment. We've got to have a system that works for everybody, both rich and poor, rural and urban, big and small. It had to work for everyone, and that coalition really pulled together and pulled that off.